All right. Hey everyone, Todd here, internalarchitect.com. In this video, I wanted to give you an update of what's happening right now with my diagnosis, with my treatment plan, and with kind of everything else that's kind of going along. I haven't updated in about a week, 5 days now, and there's just been a lot of things happening, a lot of moving parts to everything that goes along with this. A lot of it has just been family. A lot of it was just getting prepped for a treatment that's coming up, and a little bit of all the above. Just, I had a lot of work. I'm trying to work through this as much as I can, just to, one, to keep my head busy, and two, just to stay active a bit. And I'm doing things just to kind of stay active, keep the body moving, keep the body happy as best as I can. So I'll kind of rewind a little bit here of how my last week kind of unfolded. So I ended up going to work for Monday and Tuesday, and my wife ended up getting a hotel room Tuesday night so that we could be at the hospital early for my port placement. So Wednesday came, and there was just a lot of anxiety going on because of, while I was getting surgery, general anesthesia, and knocking you out, and they ended up putting a power port in. So I have a power port right over that H there, right underneath the H there, and that's going to help. Honestly, it's going to be a lot nicer to deal with all the treatment and everything that is coming forward here in the next like week or so. So I ended up getting that done. I got knocked out. Great surgeon that was able to get it in. No real problems with having it in and everything else. Definitely been a little bit sore. My whole left side is sore, and everything that goes up and into, so how this whole thing works, right? And so for those of you that don't know what a port is, it's essentially an easy access to kind of your main line, and it makes drawing blood, it makes doing the chemotherapies, any sort of other type of therapy stuff a hell of a lot easier, because you're not getting pricked in your arms and your hands, and you're not getting constant IVs for your treatments. I did the first 12 rounds when I was originally diagnosed 10 years ago. I did the first 12 rounds of treatment, the ABVD chemotherapy, through my veins in my arms, and I was really fortunate that I didn't burn my veins up, which is good. But I just remember really, every single time just getting an IV and just kind of going through it. So it's just constant picking, same. It was just uncomfortable, and it was a lot of pricks, So at the end of the day, I remember telling myself that at some point, whenever I have to go back through this, I'm just going to get a port placed. It's 100 times easier. Everything's nice and simple, and it's a lot cleaner, a lot more sanitary, and just all the above. So that's what happened on Wednesday. I had a power port put in, and you can kind of see, where is it at there? There's the scar, and then you can kind of see the port there, and it's super little, but nonetheless, it's, whatever. And the catheter kind of runs up over my collarbone and then into the vena cava, main vein that goes through your neck and down into your heart and everything. So it's just a much easier way to do it if you want to think of it that way. So with that now in, I can kind of get the treatment scheduled for everything that needs to happen. Now, what is happening is I'm actually going on Wednesday of this week. I'm going down to Denver again to see and get a second opinion from another specialist at a different hospital, because I'm not super thrilled about some of the long-term treatment plan for this and for this next section of what I'm going to have to endure. And I just, more than anything, I want to talk to them about what what their thought is. Maybe there's a different treatment plan than what the CBCI place talked about also. So I'm just getting a second opinion on Wednesday before I start treatment, just so that we're all on the same page for how we go. The other thing that we're doing also is we're going to type myself for an allogenic transplant, stem cell transplant. And what that means is I just got to do all the blood work and testing. And it goes in, we start kind of matching stuff out. I got a little bit of paperwork to do to see if my brother might be a match also for me. And if so, then we're looking good there. There's a lot of aspects and pieces and parts to going that route, but that's like if everything else doesn't work in the short term, in the micro time of everything for this whole thing. So there's that. I'm also contemplating, because I don't like how the long-term treatment effect is. They essentially call it like maintenance chemotherapy. I don't really like how that is coming about right now. So I am also going to get some information together to send down to all the doctors and everything at the Hoxley Biomedical Clinic down in Tijuana. So it's a holistic approach to maybe the maintenance side of everything. So that's kind of, I'm looking at maybe trying to do the two. A lot of as you can tell, there's a lot of ifs and a lot of questions to it all, and that's okay, because it just, at the end of the day, I want to make sure that I have everything, all the information is presented to me in as clear a form as possible that I can understand. So that's kind of where that is. My thought is kind of using both a little bit of Western medicine and holistic approach to really kind of dealing with this. My biggest fear about the maintenance chemo side of it is it's going to absolutely wreck me, and then I'm not going to be able to do anything. And I don't want, if this is going to be the way that I go out, then I want to make sure that I do it on my terms, not based off of having chemotherapy wreck my body and being just a shell of myself as I am now. So that's kind of my thought and my process at the moment, and that's kind of what my gut is telling me too. So I'm going to kind of stick with that, because my gut's done me pretty well over the years. So that's kind of where things are at with treatment. That's kind of where everything is at with the entire gamut of it all. Yeah, from right now, from recording, I have 3 days until I get my second opinion, and essentially 8 days till treatment starts. So, and then it goes into 6 rounds of, from as it looks like right now, 6 rounds of a chemotherapy, a targeted chemotherapy that will hopefully do a good number on the lymphoma itself. And then after the first 3, I'll do another PET scan to see where it's all at, and the final 3. And then from there is where the big question goes. They said I have to do maybe another 18, minimal of 18 rounds, or essentially there's 2 different things. One, the maintenance chemo, it's either I can't tolerate it anymore, or it just doesn't work. So that's why I'm really having a hard time, and that's every 21 days. So for the next 3-4 years, I'll have to do this regimen that may or may not work. And that's why I'm just thinking there has to be something better out there. It's just, I know too much about all this, and I have a lot of just frustrations about how treatments are going. So I think there's really good things about modern medicine and Western medicine, but I also know, as you probably all do, just how greedy and money hungry a lot of this other stuff, and if I personally feel like if I don't need to do this and something holistic will work for me, I think that's the way to go. So that's kind of where I'm at with my treatment stuff. I know that it's going to be an interesting journey. I know that it's going to be kind of a tough pepper to swallow and to chew on, but it's okay. It's it's part of what I have to do and what I have to go through in order to really get back in remission and live a good life. It's all about quality of life for me. It's, like I said, I don't want to be the shell of a human that I am now, just to appease doctors. So that's what it is, and that's how I'm really feeling about all this. So I think at the end of the day, for me, I'm just really playing this day by day. I'm really trying to. I've done a really good job at this point, really getting my head into a good spot right now. I have a lot of great support. I mean, everyone on the internet, social media, to just email, to phone calls. I can't tell you just how much support I got, and I can't begin to tell you just how grateful I am that I see this and I feel this, and the amount of love that I'm getting from all of you out there, and just I just want to say thank you, because as a previous cancer survivor and a new patient again, it's really, it means a lot knowing that there are people out there that completely can empathize with what I'm not only I'm going through, but their own stories as well too. And I can completely empathize with you all that have gone through it too. So yeah, just again, I want to say thank you. I want to thank you for supporting me and supporting Internal Architects channel. And if you have any questions, I've been slammed, just obviously going through all this again. I haven't been able to get back and really respond to everyone, but nonetheless, just thank you for your time and your energy into watching the videos. I'm working on a couple things to really just help you all kind of understand the big picture of what it is that's going through, and then also help you realize that there are a lot of other resources out there, financial especially, that you can utilize when you're going through this. And as I am going through this, I'm really working on putting a good list together of the things that I'm doing to really make sure that this conversation can keep happening, and that you can become informed on just how much resources there are out there for you to take advantage of. So yeah, thank you again for your time and energy. Much more videos coming down the pipeline. Just hang tight, be patient with me, and I will see you on the next video.